Proposition 52, Medi-Cal Hospital Fee Program, Initiative Constitutional Amendment and Statute. Plain language, make the private hospital fee permanent to fund public hospitals and low-income healthcare services. Medi-Cal is healthcare that California provides to 13 million low-income residents. Between 2015 and 2016, Medi-Cal paid out $95 billion. $23 billion was from the state's general fund. Medi-Cal is funded half by the state government and half by the federal government. There are 450 public and private hospitals in California providing healthcare to Californians, including those enrolled in Medi-Cal. About 80% are private hospitals and 20% are public hospitals, such as county hospitals or University of California hospitals. Private hospitals are private entities and can be nonprofit or for-profit. In 2009, the state began imposing a special charge on most private hospitals called the Hospital Quality Assurance Fee. This fee is used to fund the state's portion of providing Medi-Cal and generate state general fund savings. These savings are a result of the state using the hospital fees to pay for the children's health services that would otherwise be paid from the general fund. While a small number of private hospitals do lose money in this arrangement, California's hospital industry on the whole receives a net benefit. The big winners have been the public hospitals, who have received $235 million in 2015 through 2016 in grants and Medi-Cal payments. Fiscal Impact. The mechanics of Prop 52 have essentially been in effect since 2009, and the state has just been renewing it continually before it expires. So if Prop 52 passes, there would be no substantive change. It will just make permanent what has been up to this point continually renewed. If it fails, it will cost the state around $1 billion annually and reduce funding for public hospitals by hundreds of millions of dollars. Hello, beloved viewer. The Daryl Johnson Show needs your help. It takes so much time and energy to do these videos, I don't really have much left over for promotion and the like, but I would be endlessly grateful if you take a moment to post, message, tweet, email, Tumblr, link, Instagram, or plus my YouTube page or any of my videos and get the word out. An informed California is a happy California, and I'd appreciate your help on that. Even liking my videos here on YouTube goes a long way. Thank you very much, and now... What does it do? Prop 52 makes this private hospital fee solution permanent. It makes the repeal of the hospital fee harder by requiring a 2/3 vote of the legislature rather than simply a majority vote, and it makes it harder to change the hospital fee formulas by requiring a statewide vote to do so. Currently, the California Constitution mandates that a certain percentage of the general fund revenue be used to fund schools and community colleges as per Prop 98. Prop 52 will change the California Constitution to exclude Prop 52 revenues from counting toward that total. As you can see here from the legislative analyst's handy-dandy chart, private hospitals are essentially taxed $4.6 billion. $3.7 billion goes towards Medi-Cal payments and public hospital grants, and $0.9 billion goes to the general fund. The federal government matches the hospital fee money, and California ends up with $8.1 billion to divide back amongst all the hospitals. Like I said earlier, most hospitals come out equal or on top, and a few lose. Long story short, Prop 52 makes permanent a system where the state takes money from private hospitals in order to subsidize public hospitals and receive additional matching funds from the federal government to help fund healthcare for low-income Californians. From Yes on Prop 52. Funding. Prop 52 generates over $3 billion a year in matching federal funds that would not be available otherwise, and with no state cost to California taxpayers. It helps 13 million Californians, 6.7 million children, 1.6 million seniors with chronic diseases, 4.5 million low-income working families, and people with disabilities. It prevents the legislature from using these funds to pay for any other purpose without a public vote. Prop 52 is not about salaries or compensation. Everybody loves Prop 52. It's bipartisan and has been renewed 3 times. It has generated unprecedented support from all these people. Your yes vote on Prop 52 will keep a good idea working, one that's doing a lot of good for a lot of good people who need the help. From No on Prop 52. Prop 52 takes resources from patients and communities and siphons it into the pockets of rich special interests and wealthy hospital CEOs who are already using our tax dollars for perks like luxury car leases and golf fees, country club memberships, payments to Wall Street investors, and luxury boxes at sporting events. It lacks oversight and accountability. It forces the state to give billions in federal low-income healthcare benefits to hospitals with no oversight, no accountability, and no guarantee it will be spent on healthcare at all, let alone healthcare for low-income women, children, and seniors. Prop 52 takes money from the needy and gives it to lobbyists and wealthy, unaccountable CEOs. I don't like that this takes money from private hospitals and gives the profits to public hospitals. And I especially don't like that some private hospitals work to get by and in the end up losing in this deal. However, the no on Prop 52 camp has very few arguments, and the 2.5 it has are vague and histrionic. Both parties support Prop 52, which is significant, and it seems to me that if it were this bad, there would be a lot more people against it and a lot better arguments. One major perk, I suppose, is that this allows California to qualify for the federal matching money, which is free money. So I'll say yes because there's no substantive argument to justify a no. If you vote yes on Prop 52, you are voting to continue the private hospital tax permanently, and if you vote no, you're voting to discontinue the private hospital tax. The Daryl Johnson Show says yes on Prop 52.